Premier Higgs joins us right now. Hi, Premier. Good to see you.
Good evening, Vashi. Good to see you as well.
Thank you very much for making the time. We were told going into this meeting that it would primarily focus on vaccines. Is that the case? Is that what happened?
Yes, indeed. That was certainly the primary focus. It was about distribution and availability and you know, a recognition of what every province is doing in terms of administering the vaccines. And that, of course, we're all holding back on the second dose because we just need to get security of supply of future doses. And of course, we recognize how difficult it is with so many countries, you know, vying for limited availability of product. But we recognize the federal government's working very hard to achieve that.
So let me ask you then, from your perspective, because I'm trying to figure out where the problem is. Is it with the supply? Is it with provinces and their rollout? Is it a bit of each? From your perspective, is there a legitimate concern about the supply? Because my understanding is, for example, in Ontario, they know what they're getting over the next 4 weeks. Is it that you don't know what you're getting, or what you do know just isn't enough?
No, I think what we do know isn't enough, but that's not a surprise. I mean, I think that we all now are in a position to vaccinate at higher levels, and I think that was clearly demonstrated in the call tonight. That you know, every province says, you know, we can deliver more, but we need security on what that supply is, and we could even deliver at higher rates if we knew for sure how much was coming and when. So, you know, we all agree that throughout this whole pandemic, we've worked very closely with each other and the federal government, and it's important to continue doing this. As in the tail end of this pandemic, I'd like to refer to it as that, because we feel like the light's there. You know, we can see a hope into 2021. And I think in a couple months' time, we're going to see a lot higher availability of vaccines. But right now it's tight, and we're all working through the crisis that exists in each one of our provinces to different degrees.
Is the tone and the tenor cooperative, or and I'm not saying this of you, but some of the premiers who gave press conferences or comments prior to this were pretty accusatory about it. It didn't sound like it was going to be a friendly call. What was it like?
Well, you know, yeah, I mean, I think there was some, you know, accusations going back and forth earlier in the week, and that's unfortunate, really, because I think we all recognize that, you know, the blame game's not going to help anyone here. And the point was that we had to just buckle down and figure out, how do we work with what we have, and how do we work together to get more. And I think that's where the discussion certainly went. The conversation was amicable, and we recognize that there is a challenge to secure vaccines. There's a process for approval on some that are pending, and you know, we're very I guess encouraged by that, but we want to see that happen quickly. And so I think that at the end of the day, the recognition was we got to continue to work through this, and certainly the people in the country expect us to work together to finish this off, this pandemic, and we'll do just that.
And what did the Prime Minister and his delegates on the call say about the supply? You mentioned just a few answers ago that you expect it to ramp up in the next few months. Are there any more specifics? Like, are there specific challenges they highlighted, or what is it exactly?
Well, you know, I expect to ramp up because I expect to see more vaccines become available.
Right.
And certainly I would dare say that, you know, the Pfizer vaccine should be one that would be ramping up big time right now, because their vaccine's the more difficult one to manage in terms of logistics. And the time for them to really supply in all areas would be right now. So I would dare say their manufacturing will ramp up a lot in the coming weeks. And the issue was really, can we get security of the numbers? And I recognize the challenge that the federal government's having in trying to achieve that, because they would not be getting that secure information from the suppliers that they're reaching out to. So we are in a bit of an unknown. There are certain quantities that we do know about, but they're all very, you know, limited in the sense of our capacity and our needs.
So how much do they know they're getting? Is it a month out? Is it every week for the next month? Or do they not know? But like, are suppliers not able to say more specifically beyond that?
Well, we can look out the next to the end of the month, maybe even to the end of February, but the quantities are small in relation to the need. So I guess that's the issue, is that the country as a whole can say, okay, we're getting this many vaccines, but in terms of what we need, it's a small percentage. And that's where we are. Like here in the province, we've got over 11,000 to date. And we've administered over half of those, or right in around half, because we're holding back on the double dose requirement. And as we get more this weekend, we'll ramp right up and put them all in arms. So we're certainly doing that, but every province is in a similar comparative, because it's being distributed on a per capita basis. So proportionally, we're all in the same boat. And we can use the vaccines, but what country isn't in that boat right now?
And if you do have security of supply, at least you know what's coming, even if it's not enough over the next few weeks. Why are you still holding back that second dose?
Well, the security of supply the amounts are such that we aren't able to administer any significant amount of doses. If I knew exactly, let's say over the next 2 months, and the delivery, so I know kind of the quantity, but do I know it's coming on the 15th of this month, or is it going to come on the end of January, or maybe early February? That is kind of the unknown at this point, and I know the federal government is struggling with that, and they're trying to get security of those dates as well. Right. So those are the issues that we have to rely and say, okay, well, we know we're getting this many, so we have to ensure that, okay, we've got that double dose quantity available. Because if it doesn't arrive exactly on time, at this point, we're trying to meet a 3-week window. Now, there's some science that's saying maybe we can go longer, but that isn't approved at this stage, and so we're going with what we know. Okay.
Premier, I'll leave it there. Thanks for your time. Appreciate it as always.
You're very welcome. Have a good night.
New Brunswick's Premier Blaine Higgs. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.